Concerns over the Delta variant are only deepening following the leak of an internal document from the CDC.
Yeah, the documents obtained by the New York Times include officials saying the war against COVID-19 has changed and that universal masking is essential. Fox 12's Simon Gutierrez spoke to some local health experts about this and joins us now live with a little more context. Simon?
Yeah, some of those internal documents suggested that the Delta variant is more contagious than smallpox and Ebola and as contagious as chickenpox. What that illustrates is just how seriously public health officials are taking this threat. The idea that the Delta variant is highly contagious isn't a new one, but the tone of the discussions about the risk that the variant poses has ramped up, along with case counts and hospitalizations.
What do the local numbers tell you in terms of how rapidly this is spreading here?
We are seeing a surge that is as fast as at any other time during the pandemic. So that's a sign that it is definitely a huge point of concern in terms of how fast this is accelerating. This is in a context of a decent percentage of our population being vaccinated.
Peter GRAVEN is director of OHSU's Office of Advanced Analytics. He says given its high vaccination rate, Oregon would have been close to herd immunity against the original version of the virus.
It's only because the Delta variant is so much more transmissible that you have to get to a higher vaccine level. So that's why, I think having goals of getting to 80 or probably even 90% of people vaccinated are clearly necessary.
This week, the director of the CDC suggested fully vaccinated people infected with COVID-19 breakthrough cases could carry just as much virus as unvaccinated people and may spread it just as easily. But Chunwei Chi, director of Oregon State University's Center for Global Health, pushed back on that.
That one, I think, is still a speculation because we still don't have empirical data on that. That's just a suspicion. There are conflicting reports.
Still, both he and GRAVEN support the state and CDC's revised masking guidelines.
So I think mask policy right now is clearly the right answer. We need to buy time to get our vaccination rates up, and we know masks work.
And by buying time there, he's referring not only to those people who have been on the fence about COVID-19 vaccines, but also children under the age of 12 who have been ineligible to get them. Clinical trials are underway, and experts say that children may be eligible to get the vaccine by September or October. Reporting live in Northeast Portland, Simon Gutierrez, Fox 12 Oregon.